that are related to the nursing care to promote childbearing and women's health. So let's start with the questions. So the first question is, a young couple attend the prenatal clinic. The wife is at 8 weeks of gestation and asks the clinic nurse for information about an abortion. The nurse expresses the opinion that abortion is immoral and that many women have long term guilt feelings after an abortion. The couple leave the clinic in a very disturbed state. Legally, the So, in this question, there is a young couple who attend the prenatal clinic where the health checkup should be done of the woman from the period of conception to the birth of the baby. And the wife is at 8 weeks gestation, means she has 2 months of gestation, and asks the clinic nurse for information about an abortion. And abortion is the expulsion of the fetus from the uterus before the viability period. Viability period means about 20th week of gestation, before 20th week of gestation. And the nurse expresses the opinion that abortion is immoral. Nurse tells them the abortion is a immoral, means wrong behavior, or it is a sinful act, and that women have long term guilt feeling after an abortion. The nurse expressed their opinion about an abortion to the couple. Now the couple leave the clinic in a very disturbed state. So legally, the so according to the law, which one is the correct statement? Let's move to the options for the correct answer. So the option 1 is, a client had a right to receive correct unbiased information. So if we talk about the option first, the nurses with positive attitude and who counsel the client about the abortion should know all the services that are provided or available and what are the various methods of abortion, because the client has a right to receive correct and unbiased information. If a nurse has not properly know about the various services and method available, so the nurses who have negative attitude towards abortion should not counsel the women who are thinking of undergoing the abortion. So here this statement is right, that client has a right to receive correct and unbiased information regarding abortion. And if we talk about the option number second, the nurse's treatment need not be based on scientific knowledge. No, this statement is not applied here, because nursing practice or treatment or knowledge must be based on the facts or based on the scientific knowledge, not on the personal feelings or beliefs. So this is an incorrect statement here. Now the option number third is, physician should have been notified because nurses should not discuss abortion. Here, the nurse is also responsible for giving information about the abortion, and not there is not need to defer to the physician. So this is also a incorrect one statement here. And the option 4 is, nurse had a right to receive to state feelings as long they are identified as the nurse's own. So the nurses should give the client only information requested and should not state personal feelings. So this option is also not applied here. Here the right answer is will be goes to option number first, that client had a right to receive correct and unbiased information. So here the right answer of this question is option 1. The next question is, one day one day family planning clinic is very busy and the supervisor asks a nurse from the pediatric clinic who is strongly opposed to any chemical or mechanical method of birth control to work in the family planning clinic. What is the most professional response that this nurse could give to the supervisor? So, in this question, one day family planning clinic is very busy. Family planning clinic means a clinic that provides advice and treatment related to contraception and sexual health and provide various methods of contraception. So on that day clinic is very busy, and the supervisor of the clinic asked the nurse who is working in the pediatric clinic to work in the family planning clinic. But this nurse is strongly opposed of chemical or mechanical methods of contraception. So what is the most professional response that nurse could give to the supervisor? So let's move to the options. Here the option first is I will go, but it is against my belief. So in this option, this is an ineffective way to resolve the value conflict. So this is not a professional response by the nurse. And the option second is I wouldn't do it because I do not believe in birth control. So in this option, the nurse may not have the legal or ethical or professional right to refuse this assignment if employed by the facility. So this is also not a professional response by the nurse. And the option third is I would prefer another assignment that is contrary to my belief. And this response should indicate a positive negotiation because this will not affect the nurse's personal values or beliefs and will not cause any problems. So she responds the supervisor that she should prefer the another one assignment that is not opposite or contrary to her beliefs. So this is the right option. And the option 4 is I will have to reinforce that the rhythm method is the method of choice. So, imposing this kind of advice is unethical and unprofessional by the nurse. So, this is also a wrong one statement here. So, the professional response to the supervisor by the nurse is that she would prefer another assignment that is not contrary or opposite to her belief. So, here the right option will be option third, that is I would prefer another assignment that is not contrary to my beliefs. Now the next question is an amniocentesis done on a client on 16 weeks gestation reveals a fetus with Down syndrome. The client and her husband elect to have pregnancy terminated. What should the nurse understand when caring for a client whose pregnancy is surgically terminated? So, in this question, amniocentesis done on a client who is on 16th week of gestation. 16th week of gestation means about 4 months of pregnancy, and amniocentesis is performed. Amniocentesis means it is a prenatal test that can diagnose genetic disorders like Down syndrome, spina bifida, etc., and other health issues in the fetus. And in this procedure, a small amount of amniotic fluid is removed from the uterus with the help of the needle, and then this is sent to the lab, and lab test this sample for a specific conditions, and mainly the amniocentesis should be performed between 15th to 20th week of gestation. So in this test, result shows that fetus has a condition of Down syndrome, and the client and her husband decided to terminate the pregnancy. So, what is the main focus by the nurse to understand when caring for a client whose pregnancy is being terminated? So, let's see the correct answer of this question. So, let's move to the options. Option first is the client is emotionally unstable at that time. This is a false assumption. So, this is an incorrect option here. And the option second is there is a high risk for post-operative infection. If we talk about the option second, then here induced abortion is a sterile procedure, and this sterile procedure should not predispose the client towards the post-operative infection. So there is a no high risk of post-operative infection. And the option third is contraceptive counseling should be deferred to a later time. This option is incorrect one here because the because the contraceptive counseling at this time is most important, because the client may not return after the abortion. So this is also an incorrect statement here. And the option 4 is the client needs to express her feelings of guilt, anger and frustration. This is the correct option. Here the client need to express the feeling of guilt, anger and frustration, and it is an opportunity to express feelings about her decision should be provided. This is the most important concept to understand by the nurse when caring for a client, because the client must feel comfortable to verbalize her feeling, and this will help to reduce the grief of the client, and helps to complete the grieving process. So option 4 is the correct one here, because this is the most important concept that is understood by the nurse when she is caring the client after the pregnancy is surgically terminated. So here the right option will be option 4, that is the client needs to express her feeling of guilt, anger and frustration. Let's move to the next question. So the next question is, which research based knowledge guides the nurse regarding the emotional factors of pregnancy? So if we talk about the research based knowledge, the research based knowledge means the use of multiple resources or materials to explore the important, relevant and interesting challenges. So, which research based knowledge guides the nurse regarding the emotional factors of pregnancy? That what are the emotional factors of pregnancy? So, here the options are, option 1 is a rejected pregnancy will result in a rejected infant. Here this option is not applied here, because it is not a emotional factor related to pregnancy. Frequently maternal feelings are nurtured by the sight of infant. This is a wrong option here. And option second is ambivalence and anxiety about mothering are common. Ambivalence means two controversial ideas. Means the mother thinks is I become a good mother, or second idea is what happen if I don't become a good mother. It means there are two contradictory ideas are coming in the mind, and also anxiety about the mothering are common. So this is a normal process that is seen in the emotional factors of pregnancy, because there are hormones and various changes that occurs with pregnancy, and these changes will bring up the new emotions in the mothers during the time of pregnancy. And let's move to the option third. Maternal love usually develops within the first week after birth. If we talk about the development of the maternal love, length of time it takes to develop these feelings is specific for each individual. With some mothers it may take much longer time to develop maternal love towards the baby, or in some mothers it can take less time to develop. So it is different for every mother to develop love towards their baby. So this is not a option applied here. It is not a emotional factor related to pregnancy, because the time varies with every individual. And the option 4 is an effective mother does not experience ambivalence and anxiety about mothering. This option is also incorrect one, because an effective mother may experience ambivalence and anxiety about mothering, because it is a common, because at that time hormones are changes that brings up new emotions. So here the option second is a correct one option. There may be ambivalence and anxiety about mothering is seen, and it is a universal process. So here the right option of this question is option second. Ambivalence and anxiety about mothering are common. The next question is, why is it important for the nurses to support the parent's decision to abort a fetus with a birth defect? So, in this question, why nurses' support is important to the parent's decision to abort their fetus who has birth defect? So, if we talk about the options, first one option is supporting them will eliminate feelings of guilt. So in this option, support will only minimize the only minimize the guilt, but not totally eliminate the guilt. So this option is not a correct one option here, because support only minimize the guilt, not eliminate the guilt. And the option second is the parents are legally responsible for the decision. Nurses support does not affect the legal responsibility of the parents. So this is also an incorrect statement here. And if we talk about the option number third, it is essential for maintenance of the family equilibrium. Here the nurses support is essential for the maintenance of the family equilibrium, and support will sustain family cohesion and unity. So this is a right one option here, that it will helps to maintenance of the family equilibrium. And the last option is the nurse's support will relieve the pressure caused by this decision. So the support may help but cannot completely relieve the pressure. Here the support only helps to reduce the pressure but not completely reduce the pressure. So this is also an incorrect statement here. So the right option of this question is option number 3, that is support. Nurses support will essential to maintenance of the family equilibrium and family cohesion and unity. Now the next question is, in a lecture on sexual functioning, the nurse plans to include the fact that ovulation occurs when the. So in this question, there is a lecture should be planned on a topic that is sexual functioning, and nurse plans to include in this lecture about the ovulation process. So how the ovulation will occur? If we talk about the ovulation is the process in which mature ovum is released from the ovary, and after its release, the eggs moves down the fallopian tube and stays there for 12 to 24 hours when it can be fertilized. And luteinizing hormone regulates the menstrual cycle and relieves the egg from the ovary. And if we see the whole ovulation process, in the ovulation process mainly starts in the brain and in hypothalamus. The hypothalamus is a gland in the brain that maintains hormones level in the body, and that hypothalamus secretes the hormone that is gonadotropin releasing hormone at the beginning of the follicular stage. Follicular stage is the first day of your menstrual cycle, and this gonadotropin releasing hormone stimulates the pituitary gland to release the follicle stimulating hormone, and this follicle stimulating hormone sends the signal to the undeveloped eggs in the uterus, and these eggs starts maturing. Only one egg will become dominant and reach full maturity and will disintegrate. Now mature follicles release estrogen, a hormone that builds uterine lining to prepare for possible conception. The high level of estrogen also cause pituitary gland, that is also a gland of brain, to release luteinizing hormone. Then this luteinizing hormone tells to the ovaries that it's time to release a fully developed egg. So ovulation occurs when LH, that is luteinizing hormone level, is high. So this is a process of ovulation, how ovulation will occur. So let's see the options. Here the option first is ovulation is high. this option is not a correct one option here, because oxytocin level is high at the time of the labor, that is there is a more uterine contractions, and it is high at the onset of the labor, so it is not a correct one option here. Oxytocin is also known as let down reflex, and it is also helpful in the ejection of the milk. And the option second is progesterone level is high. Is ovulation occurs at the time when ovulation level is progesterone level is high? No, this option is also incorrect one here, because progesterone level is high at the time of the pregnancy. Progesterone is called pregnancy hormone, so this is high at the time of pregnancy. And option third is luteinizing hormone level is high. This is a correct statement here, as we already discussed that during the time of the ovulation, luteinizing hormones signals the ovaries to release a fully developed egg, and this hormone level is high at the time of the ovulation. And the option 4 is chorionic gonadotropin level is high. If we talk about the chorionic gonadotropin, it is a human chorionic gonadotropin that we have called HCG hormone. That level is high. So the HCG hormone is also called hormone of pregnancy, and the mainly chorionic gonadotropin helps in establishing and maintaining pregnancy through placentation and early development of embryo. So this is also an incorrect statement here. So here the right option will be luteinizing hormone level is high during the time of the ovulation. Here the right option of this question is option third, luteinizing hormone level is high. Now the next question is contraceptives that have estrogen and progesterone like compounds are prepared in a variety of forms. Check all that apply. So in this question, which of the contraceptives are prepared from compounds like estrogen and progesterone? Choose the options that are prepared from estrogen and progesterone. So let's see the options here. Here the first option is oral agents. If we talk about the oral agents have hormonal compounds that oral contraceptive pills contains hormones like estrogen and progesterone that helps to prevent the pregnancy, and the oral agents contains estrogen and progesterone. This option is applied here. And the second option is diaphragms. If we talk about the diaphragms are the barrier method of contraception, and it does not contains compounds like estrogen and progesterone, so this option is not applied here. And option third is cervical caps. Also cervical caps are act as a barrier method of contraception. It act as a barrier and does not contain estrogen and progesterone like compounds. So this option is also not applied here. And the option 4 is foam spermicides. If we talk about the foam spermicides, these kills the sperms, and there is no hormonal effect have seen in the foam spermicides. It does not contain any compounds like estrogen and progesterone. So this option is also an incorrect one here. It is also not applied here. And the fifth option is transdermal agents. If we talk about transdermal agents are the patches that are applied for the contraceptions, and these patches have highly effective form of hormonal compounds like estrogen and progesterone. So transdermal agents consists of compounds like estrogen and progesterone. So this option is applied here. And the sixth option is intrauterine devices. If we talk about the intrauterine devices, it contains the hormonal compounds like progesterone and levonorgestrel. And intrauterine device does not contain estrogen, it only contains progesterone and levonorgestrel, and that helps to prevent the pregnancy. So here the options that are applied is, first one is oral agents that contains the compounds like estrogen and progesterone. Another one is transdermal agents that also contains the compounds like estrogen and progesterone, and the intrauterine device that also contains the hormonal compounds like progesterone and levonorgestrel. So here the right option will be option 1, 5 and 6, that is oral agents, transdermal agents and intrauterine devices. This is all about the today's question. Thank you for watching the video. Stay tuned for the next series of questions, and if you want to see previous videos you can go to the channel playlist for the more videos. So stay tuned for the next video. Thank you.